All protocols duly observed. Mrs. Niola came to see me I think it's about a year and a half ago. That's the very first time I met her. She spoke to me she said she had recently lost her husband. And she was very passionate. One thing I noticed about her is she was very passionate about her vision. She wanted to set up a cancer screening center for colorectal cancer. And the question I asked her was, do you know what cancer screening means? What do you mean by cancer screening? Because we need to educate ourselves what cancer screening actually means. Cancer screening is, you pick up a guy on the street who is otherwise not having any problem, right? And that's what colorectal cancer is all about. You pick up a guy in the street, pick up somebody on the street who's not having any problem. You carry out a few tests on him, and you tell him, you have a problem. Are you going to leave him hanging? You are not going to do that. You have to go the whole hog. You can't leave him hanging, right? You pick up a problem, that means you're going to have to assist him. Either you connect him with the right individuals that will help him, or another NGO that will help him, or industry that will help him, that will ultimately treat him. That's what cancer screening is. Cancer screening is not just picking up the disease, because we need to be clear about it here. It's not just picking it up. You must be able to treat the individual. Treating the individual, are you going to refer the individual to a teaching hospital, or you're going to refer it to another doctor? Like everybody rightly pointed out, one thing about cancer treatment is hugely expensive. Colorectal cancer treatment is hugely expensive. I know drugs that go for $1 million. Yeah, I know drugs. Her husband took one of those drugs. I think they were going for $375,000 per course then. That was then. That drug that was going for $375,000 then is now going for about $1 million per course. We don't need to know the name. Right. So what should we talk about today? My bit today is just to talk to you about what is colon cancer. Right? It's actually colorectal, but I'm going to use the word colon cancer because Niola is it's actually colorectal, that means colon and the rectum, but I'm going to use the word colon cancer for this presentation. This is the outline I'm going to follow. What is colon cancer? Who can be affected by this deadly disease? What are the risk factors? What are the symptoms of this deadly disease? How can you mitigate your risk? And ultimately, in the event somebody has the disease, how can the individual be treated? Then you can have a number of questions. So what's colon cancer? Essentially, colon cancer is a cancer that develops in the large bowel. That's the large bowel. This small thing you're looking at, that's just a little appendix, right? That's the large bowel. Then you ultimately, and this is the anus, you ultimately pass it out. Anything you eat ultimately comes out as feces, right? That's a cancer that develops in the large bowel. That's what colon cancer is. It can develop in any part of the large bowel. But I need to inform you, right, the vast majority of cases that we see in Nigeria develop in this part of the large bowel, close to your anus. Right? You see it in other parts, but in Nigeria, I'm talking about Nigeria, about 50% of cases of colon cancer that we see in Nigeria develop around the anus. Right? Who can be affected? Anyone can be affected. That's the truth. Anyone can be affected. The average age is usually about the 5th decade. We used to talk in the past, it's a disease of the elderly. Maybe you're about 60 or 70, 7 or 8 decade of life. That's not the situation. Most of my patients are in their 5th decade of life. One of them is here today. He's just in his 40s. There are actually two of them here. One is being represented by a sister. The gentleman is in England, right? But he's being represented by the sister because he's doing well, and the other one is in his 40s. Vast majority of our patients are now in their 40s, in contradistinction to what people used to say, it's a disease of the elderly. But that's no longer the situation, right? Who can be affected? Males and females. That's the truth. The frequency is actually the same, about the same for males and females. My youngest patient is a 14-year-old. right? I think I operated him about, give or take, I operated him in 2011. I couldn't get in touch with him for this program. I don't know what became of him. But the 106, I actually operated about 6 months ago. Yeah, you're 106. I was actually surprised when I was called, right? Yes, this 106 lady who couldn't pass stool. What could cause a 106 lady? Initially, I want to show of the age. Initially, want to show of the age, but when the guardian came, the person that brought him, this 75-year-old gentleman. So, I mean, the person that brought him is 75 years old. So, we didn't have it, of course, but she's 106. This 106, she's lucid. Her memory was good. She did well. Yeah, she did very well. Of course, I couldn't invite her for this program. She did very well. I think I operated her last year. I think I operated around June last year. Right. I operated around July. She did very well. Right. That's my history. Now, therein lies the next question. What are the risk factors for this disease? There are certain things you can do about, and there are certain things you can't do about. We all pray to be old, so you can't do anything with your age. I mean, isn't it? We all pray every morning you pray to be old. I mean, thank God I'm in good health. The only sense of praying every day to be in good health is because you all pray to be old. You can't do anything about that. If you have a family history of the disease, we can do a little about that, right? It may modify the way you are treated. That's if you are fully aware that members of your family had that problem. You know, in Nigeria, the way we are in Nigeria is, he died after a brief illness. Isn't that the situation in Nigeria? You never really know the diagnosis. Everybody dies after a brief illness. You never really know what caused the problem. Now, the other one, last one at the bottom, inflammatory bowel disease, is not very common in Nigeria, so I'm not going to discuss that. Right. I'm going to discuss the ones in red are the ones I'm going to discuss about. Needless to say, if we say that colon cancer is the disease of the bowel, it's also true what you eat is what you, the saying is, I wasn't saying like what you eat is what you eat. That's essentially that. It's true for colon cancer. Right. Colon cancer is, when you talk about the frequency of colon cancer, the frequency of colon cancer in Nigeria is about 1/10 of what obtains in the US, right? It's about 1/10 of what obtains in the US or in Australia. There is a very high incidence of colon cancer in the US and in Australia. Why? Ours is about 1/10, but ours is increasing by the day. For some of these factors, like one of the earlier speakers said, we're now imbibing Western diet. It's part of it. We indulge in fast food. That's part of it. Let me tell you a little bit about why colon cancer is very common abroad and is not as common as what it obtains in Nigeria. We hope never gets to what obtains abroad. The average American eats about 180 grams of red meat in a year. 180 grams of red meat in a year. The average Nigerian eats about 8 grams. You can factor the maths. So if colon cancer is 10 times more in the US, it's not unexpected because red meat has been associated with colon cancer. It's probably one of the major predisposing factors to colon cancer. Vast majority of Nigerians will now indulge in fast food. Fast food, burger, hamburger, carbohydrates. You're just loading yourselves with poison. I don't want to use the word because I don't want some members of the industry to be affected. I'm not saying you should indulge in fast food, but you eat everything in moderation, right? Vast majority of Nigerians, they go to a party, maybe they go to a hitting joint. I want that one, a body. That's why you wrote it in Yoruba, ifun, shak. They're all fatty meals. I'm not saying you shouldn't eat them. I'm not saying you shouldn't eat them. If you eat them in moderation, they go a long way. But if you eat them every day, that'll be sad for you. That's the truth. We take pomo, which is otherwise called the rich man's meat. It's also a risk factor. I don't want to start going into the chemistry or why they are all, but the truth is there are certain the way they are prepared, they produce some harmful substances that can cause cancer in the bowel. That's why it is. I'm not going to go into the chemistry of that. We don't need to know that. But what you need to know, you and I know what homo is. You and I know what ifun is. You and I know what our body is. That's all you need to know. Incidentally, our body is the rectum. Yes, our body is the rectum, the lower part. Ifun is stomach. No. Ifun is small bowel, while shaki is stomach. Right? The vast majority of Nigerians, they'll point at it. That's what I want. That's what I want this. I think it's called assorted, if I'm right. I think it's assorted. Am I right? Yeah. That's what we want. You go to parties. How many parties do you go to that they don't serve you smoked fish? The smoked fish is either mixed with one thing or the other. People take all of this. And most of us, since we all indulge in Western diet, we're increasing our fiber, we are reducing our fiber intake. We don't take fruits and vegetables again. Have you ever wondered why people in the villages live longer than we do? That's part of the reason. Obesity, we all gain weight. We live a sedentary lifestyle. We don't exercise. These are the risk factors for colon cancer. And of course, I'm not going to talk about alcohol and smoking and alcohol consumption. Is entirely up to you to do that. We all know smoking and alcohol is virtually, especially smoking, is actually associated with all cancer, most cancers. I'm yet to know what cancer smoking is not associated with. I know it's associated with breast. Maybe it's not associated with cervix. I'm not very, very sure. But I know it's associated with colon cancer. Same thing with alcohol consumption. Smoking is actually associated with virtually most diseases. When it comes to obesity and sedentary lifestyle, apart from me being a risk factor for colon cancer, you can have other medical problems. So you don't want to do that. So these are the risk factors for colon cancer. You need to be aware of these risk factors. Fortunately, all the risk factors, you can do something about them. You can do something about all these risk factors. You can do something about them. There are very things you can do. The only thing you can do something about are the ones I enumerated earlier. What are the symptoms of colon cancer? 1, it may be silent. That means the individual has the disease. The individual has a disease, but it's not showing any sign. It's not telling you he's having abdominal discomfort. It's not passing blood in stool. It's not having any abdominal pain. It's silent. That's one of the problems with colon cancer. Many a time, even most cancers, as a matter of fact, most cancers are usually silent in their early stages. That's the truth about most cancers. Most cancers are usually very silent in their early stages. That's when comes in the issue of screening. To pick it up in these early stages when it's silent. Why must we pick it up when it's silent? The truth about it, when a malignancy is silent and it's picked up very early, the cost of treatment is very small and the outcome is efficacious. When the disease is advanced, the truth about it is, when the disease is advanced, we try our best as doctors. I'm not saying you're going to abandon your loved one that has an advanced colon cancer. I tell you, go and buy a drug that goes for ₦1 million. If you can afford it, you're going to buy it. But I know deep down in me, the prognosis is guided. The chances that the individual will be alive in the next 5 years is, should we be talking about 5 years? I don't want to talk about years. Maybe we're going to be talking about months. We don't want to get to that stage, right? We don't want to get to that stage. What are the other symptoms? You may just have persistent abdominal discomfort. That's another symptom. Yeah, the most important thing, in the video shown earlier, never trivialize it if you pass blood in stool. Never trivialize it. I agree with you. The commonest cause of passing blood in stool is what we all call pile or hemorrhoid, right? But the pile or hemorrhoid could coexist with colon cancer, right? Could coexist with colon cancer. So never trivialize it. Oh, I passed blood in stool. It happened yesterday. It happened 6 months ago, and you're now coming to see me. That shouldn't be the case. Never trivialize it. Never trivialize it. It's an important thing. Find out why you pass blood in stool. Always find out why you pass blood in stool. It's not something to be trivialized. Another thing that happens to so many people. So many people. We talk about they develop a change in bowel habit. You and I. Ordinarily, everybody, virtually everybody, at least maybe once in 2 days you pass stool, isn't it? You all pass stool once in 2 days or worst case scenario, once in 3 days. For most people, that's the situation, right? Once there's a change, maybe that 1 in 2 days progressively changes to 1 in 4 days. Or for you even to pass stool, you now have to use a lot of purgatives to pass stool. There is a problem. You have to figure out what the problem is. And vast majority of people, if I take a census there, do you actually look at your stool? Do you actually look at your stool? Most people don't. They don't know what their stool looks like. Most people don't know. You may have been passing blood in stool for months. They wouldn't know. If your bowel habit has changed, i.e., the frequency has changed, the caliber of the stool has changed, you are passing blood mixed with stool, or you are passing mucus in stool, these are signs that there's a problem. You have to figure out what the problem is. These are the things. You just have to figure out what the problem is. At times you may pass stool, right? You've passed stool, or you have the urge to pass stool. For one reason or another, you feel that as if you've not completely emptied your bowel. There's a problem. You try it again, nothing, as if there's something inside. The truth about it is, if there's a tumor in that lower part of the part I call the one close to the anus, right, the rectum, if there's a tumor there, can you actually, it gives you the urge as if you want to pass stool. But the truth about it is, can you pass it out? No, no way. You're not going to be able to pass it out. That's why it gives you that urge. So these are things you don't trivialize. I'm not going to talk about weakness or fatigue or unexplained weight loss. By the time you start having weakness or fatigue or unexplained weight loss, you're dealing with an advanced disease. I don't want anybody to get to that stage for picking up the disease. What can you do? I've spoken to you about the modifiable risk factors. These are the ones I enumerated earlier. And 2, know your body. Never trivialize any change. Figure out what's causing the problem. If you're not happy with your doctor, change your doctor. That's the truth. If you're not happy with your doctor, change your doctor. Then you can afford it. You screen for colon cancer. That's why Niola is here for you. Right? Niola Cancer Center, we want to build that. That's like 4 or 5 Prado Jeeps, I'm very sure. Prado Jeep goes for that 5 million. By the time Prado Jeep goes for that 5 million.
23 million.
All right. Yeah, all right, good. All right, let's say I'm very sure when you go out there, you can pick up like 10 Prado Jeeps. If you sell 10 of them, if they are 23 million, it depends on where you're buying it. If you're buying it from Lizard, it's at 5 million from a Lizard. So if you buy like 10 Prado Jeeps, it is set up a cancer center. That's the situation. You can do a colonoscopy, you can do a CT scan for that. How do we customarily manage colon cancer? Like rightly pointed out, colon cancer is a disease that's actually not only can it be cured, it can be prevented. It can only be prevented if it's picked up very in its, what we call its precancerous phase. There's certain growths in the body, we call them polyps. I'm going to show you. If those polyps are recognized, the polyps can only be recognized when you do colonoscopy. If these polyps are recognized and polyp is removed, you essentially cure the individual of even the polyp has not even developed into a cancer. The polyp will ultimately develop into cancer. How long does it take? Customarily, though it varies, it may take about 5 to 15 years before a polyp develops into a malignancy, into a cancer. It may take about 5, but it may vary from one individual to the other. But that's just an average thing. It may take about, it may be longer in some individuals, it may be shorter in some individuals, depending on the predisposing factor or their genetic makeup. But either way, if it's picked up early, in that polyp stage, if that polyp is removed, right? Of course, you can't remove that polyp with a colonoscope. If that polyp is removed, You essentially prevented the individual from developing a malignancy. That is why colon cancer is preventable. In contradistinction to breast, there's very little you can do about breast. You can't prevent it. You can only pick it up early, unless you want to go and remove your breast, like Angelina Jolie. That's the truth. That is the truth. You can't do anything about it. But colon cancer can be prevented if it's picked up. If you pick it up, this polyps, these are usually the treatment we do for cervical cancer. It's usually a combination of surgery, chemotherapy, and radiotherapy. This is an example of a polyp, right? This is an example of a polyp. Before it eventually becomes malignant, I don't want to use the word malignant, before it eventually becomes cancer, right? It may take some years, like I mentioned earlier. About 5 to 10 years, but it varies from one individual to the other. That's the truth. This is a polyp being removed at colonoscopy. You take out that polyp, you essentially have prevented the individual from developing a malignancy. So what's the take-home message? The take-home message here is anyone can be afflicted by this deadly disease. It could be a totally silent disease in its early stages. Risk of developing colon cancer can be substantially reduced. I spoke about the modifiable factors, healthy living, screening. More importantly, never ignore or trivialize any changes in your bodily function. It's healthy living. We don't do that again. Do you take bananas? Do you take fruits? Do you take apples? Nobody. We don't do that again. Everything is fast food. Everything is fast food. We don't do that again. People in the villages who probably don't develop colon cancer, if we actually need to do a study and make sure people in the villages don't develop colon cancer as much as people in the cities, we're also exposed to so many things in the city. Nearly everybody has a gene. The fumes from the diesel gene affects you. Right? It affects you. Look, when I travel, when I go outside Lagos for any reason, I breathe better. Everybody can attest to that. When you travel outside Lagos, you just realize you are breathing better. So you can imagine what you are going through your body every day. It's fine.
We didn't touch, I think you skipped it a bit, when you talked about the cramps and you talked about the cramps. Then the gas, what do you mean by gas? Is it too much of gas or less of gas? Or?
No, it could be.
I didn't just get it.
Let me do something. When somebody has abdominal discomfort, there's something wrong with you, right? Yeah. It could be an upper thing. It could be what you think. But for vast majority of people, erroneously, you probably think you have ulcer. You start taking mist mag. It's not that simple as straightforward, especially when it becomes a chronic problem. You've had it for months. Never trivialize, try and figure out what the problem is, right? Of course, there's something wrong with your tummy. That's why they're passing a lot of gas, or there's something wrong.
Good morning, the afternoon, sorry. Thank you for the presentation. I just wanted you to say a little bit more on colonoscopy, the screening.
Yeah. What's colonoscopy? Yeah.
Then also the fecal occult blood testing.
Yeah.
So everybody in this room knows when they are supposed to walk in for the next colonoscopy. Thank you.
You see, that's good. I need to say something. That's quite a very difficult question for me to answer, right? Because I don't want a situation whereby everybody here, after this had Dr. Osinowo, everybody runs and do a fecal occult blood. That's going to create a problem for me. Because why? Let me tell you something. Let me tell you something about screening, because that's one of the ways for screening for colon cancer, unquestionably, right? Fecal occult blood is a lot cheaper than colonoscopy. It's a lot cheaper than colonoscopy. And it's that you're not going to experience any discomfort, right? Abroad, where they have guidelines for colon cancer, we don't have that in Nigeria. But we can have it in Nigeria. We can't. That's the truth. We can't start saying the government should lay up policies so that we start screening for colon cancer. We truly can't do that. My take on that is, if there's a problem with you, right, it may have to start with fecal occult blood. You can actually use the fecal occult blood to determine whether you are going to require a colonoscopy. Why? Because Lagos has a population of about depending on which census we are talking about. Is it 21 million or 20 million? Whichever one you are talking about. How many doctors can do colonoscopy in Lagos? How many centers do they do colonoscopy? I can count the number of doctors that can do colonoscopy in my fingers, but not 10 in Lagos that can do colonoscopy. So if you start saying everybody should jump in and do a colonoscopy, I won't have any other work to do. I won't be able to operate Mrs. Ojo or Mr. Odua. So it's a little bit complicated, right? But if there's a problem, you have a problem, you have an abdominal problem, you have a discomfort, you can start out with fecal occult. As a matter of fact, maybe what I'll probably advocate is if you're in your 40s, mid-40s and above, because vast majority of our patients now are in their mid-40s, right? You could start out with a fecal occult blood. If it turns out positive, right, you can now elect to do a colonoscopy, which is much more expensive, right? I think I'm very sure a fecal occult blood probably costs you 1,000 naira. A colonoscopy will probably cost you 50 times more. 60. Whatever.
For me, one thing in Nigeria is about stomas. Stomas. Yeah. A huge problem. And managing them, the expertise, the appliances, etc. Yeah. So I don't know whether you talked about it to everyone, because it's an integral part of, and it's something that, why I'm mentioning it is something that I'd love for the Cancer Care Foundation to take on as well. So if you probably tell them what a stoma is and why it is an issue.
You see, Mrs. Ojo can attest to that. What he's talking about when you talk about stomas. What do you mean by stomas? To the layman, you want to operate, if the disease is low down, right? If the disease is low down, right? I'm sorry. If the disease is here, if the disease is somewhere, this area we call the rectum, right? There's a possibility that after surgery, you may need, depending on the location of the tumor, you may need to create what we call a new anus. It may be temporary for some patients and maybe permanent for some patients. What I mean is you create a new anus. It's surgically fashioned. What comes up from the anus? Stool and feces, isn't it? You create, Mrs. Ojo had it. For how many months, man? I can't recall. Maybe you had it for about 8 months. You had it for about 8 months. You create a new anus. It may be around there. Vast majority of Nigerians can't tolerate it. Some people probably won't opt for surgery because you are going to create, unless you have the highly motivated patient that says, and you can guarantee the patient that this new anus I'm creating for you is temporary. If you tell a patient that this anus we are creating for you is going to be permanent, they're not coming back for your surgery. That's the truth. They are not coming back. So we also have a problem in Nigeria. We don't have the appliances like you mentioned. Apart from patients not wanting to tolerate it, we don't actually have the right, they call them colostomy bags, right? We don't actually have, many people are not bringing them in. I don't know, with the increase in dollar and everything, I don't know how it's going to affect things. Some patients actually use black nylon bag. Yeah, some patients use black nylon bags for colostomy bags. Unfortunately, I'm sorry, so I didn't show you a photograph of a colostomy bag. That's how things are. I think we need to be aware of this disease and do something about it. Thank you, everyone.
Thank you very much, ladies and gentlemen.